My name is Sara Tolaney. I'm a breast medical oncologist at Dana-Farber. Study 218 was a multi-center phase 1b/2 trial that evaluated the safety and efficacy of a combination of eribulin and pembrolizumab in patients with metastatic triple-negative breast cancer who had received up to 2 prior lines of chemotherapy for their metastatic disease. There's a lot of preclinical work that has suggested that combining chemotherapy and immune checkpoint inhibition may result in synergistic activity, which has been quite promising in triple-negative disease, and so we wanted to explore this combination for these patients. This was initially a phase 1b to evaluate the safety and establish the recommended phase 2 dose for the combination of eribulin and pembrolizumab. And then we conducted a phase 2 trial in which we enrolled approximately 88 patients to evaluate the efficacy of the combination. The primary objective of the phase 1b portion was really to look at safety and tolerability of the combination. And for the phase 2, it was to look at the objective response rate as established by RECIST 1.1 within those patients. So the phase 1b looked at 7 patients who received the full dose of eribulin and pembrolizumab and did not find any dose-limiting toxicities within these 7 patients. And so given that, we established the recommended phase 2 dose of the combination to be the standard eribulin dosing, which is 1.4 milligrams per meter squared given on days 1 and 8 of a 21-day cycle in combination with pembrolizumab at 200 milligrams given every 3 weeks. The phase 2 portion of the trial enrolled 32 patients at the time of this interim analysis, and it found that the objective response rate amongst the patients was approximately 33%. The toxicities that were seen in the trial were really consistent with what one would expect with either eribulin or pembrolizumab when either agent has been given alone. So we found the most common adverse events were fatigue, peripheral neuropathy, neutropenia, and nausea. Outcomes for patients who have metastatic triple-negative breast cancer are much worse than those patients who have other subtypes of breast cancer. And there's a great need to try to develop better therapies for this patient population. There's been a lot of interest in immunotherapy, in particular for these patients, and these results suggest that there may be activity for these patients with this treatment regimen. I think one great hope is that the introduction of immunotherapy to patients with triple-negative disease may result in better long-term outcomes. And so we really need further follow-up of this trial to establish how long the treatment durability is from the combination. I guess one interesting finding that this study did reveal was that response rates for those patients who were PD-L1 positive were really the same for those patients who were PD-L1 negative. Previous work looking at pembrolizumab has really focused on those patients who are PD-L1 positive. And so I think this is a very interesting finding because it suggests when you combine chemotherapy with immunotherapy, it may be active regardless of PD-L1 status. So it may broaden the applicability of the use of immunotherapy by using a combination treatment for triple-negative disease.